Welcome to Neurology Now. I'm Stephanie Stevens. I'm with Dr. Joseph Sirven. He's a professor of neurology at the Mayo Clinic in Phoenix, Arizona, a member of the Neurology Now editorial board, and a recognized specialist in epilepsy. Today we're talking about epilepsy and stigma. Approximately 150,000 people have epilepsy in this country. In fact, it's the fourth most common neurologic problem. Dr. Sirven, epilepsy has a dark past. People with it were once thought to be possessed or even demonic. In the 18th and early 19th centuries, they were labeled insane and committed to asylums. We have come a long way since then, but why does the stigma around epilepsy still persist?
You know, that's a fantastic question, and many of the answers to that question are very much buried in the premise of the question. The fact is, for decades, centuries, epilepsy has always been relegated to an otherworldliness type of condition. And because of the way it can appear or the way that individuals may act during a seizure, it's very hard to shake those old labels. Adding to it, the fact that although neurologists and other professionals that are involved in the care of individuals with epilepsy know about epilepsy, perhaps we don't share enough about our knowledge about it, talk about it, and it tends to get buried. And as such, nature abhors a vacuum, and people fill it with still tales of things that are wrong or inappropriate. And that's what's hard about this. It's been so buried, so not discussed, that a lot of misperceptions have been allowed to take hold. And as anyone knows, it's very hard to shake a habit.
What kinds of stories do you hear from your patients? I imagine many are heart-wrenching.
You know, they are. The stories that I hear from patients with regards to stigma, they really do break your heart. A lot of them vary upon age group and age-specific issues. In children, you hear about shunning or teachers who are supposed to be the support that completely don't get it and have their own biases. As you get into adolescence, you hear about not socializing as much or not dating. As you get into adults, you hear about not being able to drive in some cases, losing the job, not being able to keep a job, getting fired. And as you go on forward, you hear about losing your independence. And so the stories, they really kind of cover almost any imaginable thing you can put out there. Romance, work, exercise, but the themes are all the same: exclusion, dependence, trying to undo misperceptions.
A 2011 Canadian study of more than 10,000 tweets containing the word seizure collected during a single week found 41% were considered to be derogatory. Why are seizures so misunderstood, and what do you wish more people knew about them?
You know, another great question, and the point is, I think it's misunderstood, again, primarily because it has not been a topic of conversation. And so what happens is people only take the images of seizures that they know and assume that is basically relatable to everyone else in the population. So most ideas of seizures come from television and or movies. The problem with that is that those are going to be done in a very Hollywood, melodramatic style with a lot of emphasis on one type of seizure, which is a generalized convulsion, and not relating to the many other myriad ways that they can present, which in some cases can be subtle. And as such, people only think of the larger events that they can relate to on TV or in some type of art. And that is why a lot of times people tend to do it in a derogatory nature. Added to that, there's a lot of jokes that come as part of that. And that is one of the difficult part of the reality when it comes to epilepsy, is that there's always that negative vibe because of that misunderstanding. And what I wish people understood is how much that seizures are such a range of behavior. It's extremely common. 1 in 26 people in the United States will develop epilepsy. 10% of the world's population will have a seizure. And lastly, any brain is capable of having a seizure in the right circumstance. So we're not all that different. It's just our set points may be at a different level. And I think that's what people, I wish they understood, is that it could just as easily happen to you.
Do you think patients' fears about stigma keep them from getting help?
Patients do keep quiet sometimes, or individuals with epilepsy do keep quiet because of the stigma. I've heard people who basically are afraid to get help because they don't want to get labeled with a term, or perhaps they don't want to, in the instance of driving, go to a practitioner and tell them about seizures, and they may realize that there's a driving law, for right or wrong, that is written that may end up taking away transportation options from them. And we have seen that happen. So there are things about the stigma, the laws, the social aspects that do prevent help from occurring.
There are many misconceptions about people with epilepsy, including that they have neurologic disabilities or they can't keep a job. Maybe they're even short-fused or violent. What are some ways to deal with these misconceptions?
I think the practical ways to deal with these misconceptions are, I think the simplest way is there are multiple levels of doing it. I think it depends on who you are. If you have a friend, a loved one, or someone with epilepsy, talk about it with people. Don't hide it. The more you hide it, the worse it gets. Yes, there are some practical aspects of how people may react, but the more people get to know that these individuals with epilepsy can be any of us, the better it is. So talking about it is probably the cleanest, simplest solution. At a medical level, we need to talk to all of our colleagues and other patients, and just advocating about knowledge and letting people aware that this occurs, that people can have a life, and that one should not stigmatize folks against this. This has happened in a lot of different conditions, such as infectious diseases, mental health. Epilepsy has not come to the game or the table not till recently, and we just have to talk about it. I think that's the simplest, cleanest way in terms of a pragmatic solution.
For those of us who need a reminder, what should bystanders do and not do when someone has an epileptic seizure?
Sure. The seizure first aid is actually super easy. It's make sure that the person doesn't get hurt. And the way you do that is if someone has a seizure, if they're standing up, get them to a safe place on the floor if they look as though they're shaking or could potentially fall. Move around the things that could hurt them so that they do not get hurt or injure themselves. Then let it just occur. It will pass. If they are having problems with breathing or they're turning blue, get help or ask someone to call for help. Turn them on their side. That helps to clear their airway in case they're having a major seizure. Do not stick anything in their mouth. There's an old wives' tale of putting, trying to hold a tongue back or putting things in their mouth to prevent that. Leave it alone. Do not touch anything with the mouth. That'll only make it worse. And then keep abreast of what you've just witnessed, because those details may be quite useful to the neurologist who's going to help care for them once they get to help.
To learn more about epilepsy, go to neurologynow.com and search epilepsy. Thank you for your time and input, Dr. Sirven, and thank you for joining us here at Neurology Now. I'm Stephanie Stevens.